If you are wondering whether you need a scan because you have an injury or you're in pain, then you are in the right place. In today's video, we're going to go through when it may or may not be appropriate to have a scan and just make you aware of some of the considerations that you need to think about before having one. This is the second part in a two-part educational series on imaging and diagnostics, and the first one just went through the different scans that were available and the different conditions that they were used for. And you can find a link to that in the description below. Make sure you stay tuned until the end, where we're going to go through some very interesting research that tells us who does better, people that have scans or people that don't. Welcome back, it's Luke here from Genuine Physio, where we bring you honest, evidence-based information and education to get you guys back on the road to recovery. You can find us on all of the main social media platforms, Facebook, Twitter and Instagram, and we're keen to be interactive with you guys, so come and chat to us on one of those platforms or drop a comment below and leave some feedback on today's topic. If you like what you see, then please give us a thumbs up. It really does help grow the channel, and if you haven't already, subscribe to the channel so you don't miss any more of Genuine Physio's videos. And with all that out of the way, let's get going. So when is a scan appropriate? Well, it's definitely appropriate if you present with any red flags, and they are a series or set of symptoms that could indicate serious or sinister pathology that would need urgent medical attention. For back pain, any red flags around cauda equina would indicate a scan, and conveniently I've put a video together on that exact topic and you can find a link to that in the description below. But other conditions would include a fracture, cancer or tumour, or maybe early diagnosis of an inflammatory condition. Given that scans are indicated for serious or sinister pathology, let's have a quick chat about some common misconceptions and considerations that you need to take into account before you think about having a scan. The first consideration is diagnosis, and it's kind of a misconception as well, because many people do believe that you need a scan to have an accurate diagnosis. Now, it depends what country you are from, but most definitely here in the UK, your healthcare professional, whether it is a doctor or a specialist musculoskeletal therapist, will have been educated and trained for years in diagnosing musculoskeletal injuries. How this works is the clinician will ask you a series of questions, and this is called the subjective assessment. Every single question they ask you is designed to push them in a direction of diagnosis. So even before they complete the physical examination, if it is a common musculoskeletal problem, they will already have a very good idea about what the diagnosis is. What happens next is the clinician will then do a physical assessment, also known as an objective assessment. And unfortunately for you, these are a series of pain provocation tests. And basically they're designed to stress different structures of the body to try and let us know which structures are involved with the injury. For example, I might do a stress test to the cartilage in the knee, and if that produces a pain response, that would indicate to me that the cartilage may be involved in the injury. So once the questions and the physical examination have been completed, the clinician should have a good idea about what the diagnosis is if it's a common musculoskeletal problem. And the beauty of seeing another human is that you can tell them about your pain and they will listen to you, which you can't do to a scan. And we'll discuss in a bit more detail why that is important a little bit later in the video. The second consideration is what is normal. Do you know what a normal scan looks like? If you're watching this video, you've probably either had one or you're thinking about having one, and you need to know what a normal scan looks like. One of the biggest factors, I think, in the persistent pain epidemic that's going on at the moment is that people are given scans without context of what is normal and without context of their age. So what do I mean by this? We'll take a look at this table. This was a study completed back in 2014 by Brinjikji and his friends, and they took lumbar MRIs of over 3,000 asymptomatic people. That means over 3,000 people that were completely pain-free. And what their investigation found was that things that in the medical profession we deemed as problems and pathology in the past were actually present in people with no pain at all. Things like disc degeneration, disc height loss, and disc bulges were present in 20-year-olds, and this gradually got worse as people got older, despite the fact they had no pain. What this study really shows us is that pathology is present in all of us, and that it will gradually get worse as we get older. It doesn't necessarily mean, however, we should be in pain. It's a little bit like getting grey hairs and wrinkles, but on the inside. The findings sound quite worrying and concerning. They're quite long medical terminology. So if you're not given the results in context of what is normal and in context of your age, then it can make you quite fearful and anxious. And all of these psychological things we know tend to make your pain worse. The third consideration to take into account is how well do scans correlate with pain. Now, I've kind of answered this question in the last consideration, but it is important to know that, you guessed it, they correlate poorly with pain. For example, you could have somebody in hardly any pain with a knee x-ray that looks really, really bad, and you could have somebody in lots of pain with a knee x-ray that looks nearly fine. And the reason for this is pain is very complex. There are many different factors that affect it, and isn't necessarily always a sign of tissue damage. Now, I know this sounds strange, but I put together videos on the different factors that affect pain and why pain doesn't necessarily equal tissue damage, and you can find those videos in the description below. In addition, it's estimated that 1 in 3 people have a joint replacement that they don't necessarily need. And this is because they go to their doctor and they're given a scan, and the scan is perceived as bad, or there's a significant amount of pathology there. And despite the fact that we know pain correlates poorly with scans, they're sent to an orthopaedic surgeon and then they have surgery. What we need to do is stop treating the scan and start treating people as individuals and taking into account all of the different factors that may be affecting their pain. And the fourth consideration to take into account is how will this scan affect or change your treatment? It's very well researched that the majority of musculoskeletal problems should be managed with conservative treatment before trying anything else. And what I mean by conservative treatment is education, advice, exercise, heat, ice, maybe manual therapy, maybe medication if appropriate, before considering anything more invasive. And there are a few reasons for this. Firstly, invasive treatment doesn't always work. Secondly, the more invasive the treatment, the riskier the side effects, generally. And thirdly, the further you go down the invasive treatment line, the less options you have further down the line. So, unless you like the sound of needles and injections and the surgery, conservative treatment is always recommended first. So, going back to the scan, if you have that right at the beginning of that process, it is very unlikely to change the recommended conservative treatment that you're likely to have. If, however, you get to the end of the conservative treatment period, which typically lasts 3 to 6 months, and either things have not improved as expected or you're not satisfied with your current level of function, then you will be assessed again by a clinician and you will decide together whether a scan would be appropriate. Now, if you remember at the beginning of the video, I said if you stay tuned, I'll give you some interesting information about who gets better quicker, people that have scans or people that don't. Well, I'm going to refer you to a piece of research that was completed back in 2013 by Webster and her friends. And what they did was they did exactly that. They compared people who had early MRIs with back pain to those that didn't have early MRIs but had back pain. Specifically, what they did was compare a group of people with non-specific low back pain, which is just localized back pain, and a group of people that had radicular back pain, which is true sciatica, so your back pain plus some neuropathic leg pain. And they found a number of things. The first interesting thing that they found was that 37% of the people that had non-specific low back pain were given an early MRI, and nearly 80% of people that had ridiculous low back pain were given an early MRI in absence of any red flags. This finding wasn't really why I picked this piece of research, but it is definitely worth touching on. It's very well evidenced that we should not be giving people unnecessary imaging too early on in their treatment. But why is that happening? Well, I do think it is probably more common in private healthcare systems than public healthcare systems. But for me, it shows a flawed system if healthcare professionals are financially rewarded for giving you unnecessary treatment and, for example, imaging. It's the elephant in the room and it's controversial, but it is definitely worth talking about and it is definitely worth thinking about. The main reason I wanted to tell you about this particular piece of research was because of the second thing that they found, and that was when they looked at the days of disability that people had with low back pain when comparing early MRI to no MRI. And what they found was that the people that had an early MRI had a significantly longer period of disability than those that had no MRI at all. And the last thing that they found was that the people that had early MRI scans went on to have greater health needs and they had significantly greater health costs. And since this piece of research in 2013, there's been many other pieces of research that have confirmed the same thing. So why was this? Well, conveniently, they mentioned many of the things that we have spoken about today. The fact that images were often confused or misinterpreted and people were told they had pathology when it was actually just normal or incidental findings. Secondly, the fact that having a scan can lead to invasive, unnecessary treatments. And thirdly, the fact that if people were not given the images in context of what is normal or normal for their age, that could lead to negative health beliefs and fear-avoidant behaviours. Before we finish, just to recap, scans most definitely are appropriate for anybody that presents with red flags that could indicate serious or sinister pathology. However, for most common musculoskeletal problems, a qualified healthcare professional should be able to complete a thorough assessment and subsequently give you a diagnosis. Whether you've had a scan or you're thinking about having a scan, it is very important that you have a good, thorough understanding of what is normal in context of your age, just to put things into perspective. And be aware that scans correlate poorly with pain. Just lastly, most musculoskeletal conditions are managed conservatively first. So whether you have a scan or not, it is unlikely to change your treatment plan. As always, thank you so much for watching. I hope you enjoyed today's video. If you did enjoy it and you haven't already, make sure you check out part 1. That just went through the different scans that were available, how they worked and the different conditions they used to look at. The other one you might also find helpful is the one we put together on the back pain red flags. That is a must watch. Please give us a thumbs up and subscribe to the channel if you haven't already so you don't miss any more of Genuine Physio's videos. You can find us on all of the main social media platforms, and if you would like to look into today's topic in a bit more detail, you can find some useful information in the description below, including the research articles that we spoke about. But before you go, I would love to hear from you, so tell us a few examples of what we have spoken about today. Maybe you had a scan and it did make you a bit worried, or maybe you had a scan and you weren't given the results in context of your age, or maybe you had a really good experience. Drop a comment below and let me know. But until next time, I'll see you again very soon.